The most constant feature of all effective weight loss diets is that they're low in calorie. Beyond that, popular weight loss diets vary considerably in terms of macronutrient composition, specific food recommendations, and timing of the eating. These differences are purported to alter the fundamental mechanisms of weight control, energy balance, fat tissue signaling, and widespread inflammation. Insulin sensitivity and blood sugar control, appetite signaling, health of the microbiome, epigenetics of metabolism, and the alignment with the circadian rhythms. However, whether a diet will result in weight loss depends largely on individual characteristics that influence our response to dieting. Such characteristics are still poorly understood, but they may be partly related to genetics. It's important to note that not all weight loss diets, even if they work, improve long-term health. Marketing campaigns associated with various weight loss-oriented diet programs claim the diet in question can influence energy expenditure and appetite signaling, making weight loss easier and more effective through the manipulation of the proportions of the macronutrients, the carbohydrates, the proteins, and the fat. However, this is a contentious area of active debate and investigation among the nutrition research community. The low-fat diet, popularized by Dean Ornish, MD, in the 80s, was introduced as a cornerstone of holistic approaches to prevent and reverse heart disease. The Ornish diet, which is plant-based and derives of less than 10% of calories from fat, emphasizes whole, unrefined foods, and it incorporates large amounts of low-calorie density, high-nutrient foods like fruits and vegetables. Research has shown that restricting saturated fat may be more important than the total fat, and dietary fat reduction has metabolic benefits only if the fat calories are not replaced with carbohydrates, particularly processed carbohydrates such as starches and sugars. In a less restrictive low-fat diet, in which no more than 30% of the calories are from fat, and it also limits the intake of saturated fat, cholesterol, refined carbohydrates, sugars, and sodium, the DASH diet has been found to lower the cardiovascular risk and blood pressure and promote weight loss and reduce the risk of type 2 diabetes. A meta-analysis of 54 trials with a total of more than 30,000 overweight and obese participants found low-fat and low-saturated fat weight loss diets reduce premature mortality, resulting in 6 fewer deaths per 1,000 participants. In general, low-fat diets have similar weight loss effects as other diets with similar daily calorie intake. Interestingly, their effect on markers of cardiovascular risk might be different than those of other weight loss diets. A meta-analysis that included 20 studies with a combined total of 2,106 overweight and obese participants found low-fat diets improved the total and the LDL cholesterol levels more than the high-fat diets, but high-fat diets improved the HDL cholesterol and the triglyceride levels more than the low-fat diets. The possible implications of the differences for long-term health outcomes is still not clear. Robert Atkins first proposed his ketogenic, high-fat, low-carbohydrate weight loss diet in the 70s. More recently, low-carbohydrate diets, referred to as the paleo and the keto diet, have been more popular. Restricting the carbohydrate intake reduces blood sugar and insulin levels, and it increases fat metabolism, resulting in increased levels of byproducts known as ketone bodies. By regulating glucose levels and stimulating ketosis, this diet might lead to better appetite signaling and glucose metabolism. In general, low-carb diets, high in fat and/or protein, have been shown to induce more rapid weight loss than high-carbohydrate diets. However, to date, researchers have failed to find a significant advantage on long-term weight loss. Furthermore, high-fat, low-carbohydrate diets have been found to have negative impacts on the LDL cholesterol levels and vascular health in some studies, even while having positive impacts on HDL cholesterol and triglyceride levels. Very low carbohydrate diets, such as the ketogenic diet, include no more than 50 grams of carbohydrate per day. They're typically low in fruits, vegetables, and fiber, and they rely on calories from animal fat and protein. This can lead to poorer long-term health outcomes. In fact, a recent study that followed more than 15,000 adults for about 25 years noted very low carbohydrate intake, when accompanied by high intake of animal fat and protein, and it was associated with a 20% increase in death from any cause. The study also found very high carbohydrate intake, greater than 70% of the calories, was associated with increased mortality, suggesting moderate carbohydrate intake might be optimal for long-term health. Dietary protein reduces appetite, preserves muscle, supports insulin sensitivity, and promotes thermogenesis. Comparison trials suggest high protein diets have better short-term weight loss effects than high carbohydrate diets, but findings from longer studies have been inconsistent. One meta-analysis of the studies found higher protein intake was associated with less weight regain after successful weight loss in overweight and obese subjects. This might be due in part to protein's satiating effect. It's important to note, however, that a high intake of animal protein has been linked to an increased risk of kidney stones, as well as chronic health problems like heart disease, type 2 diabetes, and cancer. Plant proteins, on the other hand, are not associated with these health problems. Many people on weight loss diets use sugar substitutes to reduce their calorie intake while enjoying foods that taste sweet. Artificial sweeteners like aspartame, sucralose, and saccharin have been promoted to diabetics and dieters as healthy sugar alternatives for decades, but their role in metabolic disease now appears to be more complex than previously thought. In fact, although the evidence is not conclusive, the consumption of artificial sweeteners has been implicated as a possible contributor to the rising rates of obesity and diabetes, and it may also be linked to the development of metabolic syndrome. Sweet-sensitive taste receptors are known to be present in the mouth, the gut lining, the pancreas, and the brain. By activating taste receptors throughout the body, artificial sweeteners can alter the production of neurotransmitters and hormones that regulate appetite signaling and glucose metabolism, which has been found to trigger metabolic dysregulation in preclinical research. In addition, animal studies suggest artificial sweeteners can cause inflammation in the digestive lining and alter the gut microbiome, potentially leading to leaky gut, systemic inflammation, and insulin resistance. The Mediterranean diet is one of the best supported dietary patterns for long-term metabolic health. Although not inherently a weight loss diet, when implemented as a low-calorie diet and combined with exercise, the Mediterranean diet promotes weight loss similar to other diets with similar degrees of calorie restriction, while also improving blood pressure, lipid levels, and other markers of cardiovascular health. With its emphasis on fruits, vegetables, whole grains, legumes, nuts, and olive oil, and the inclusion of modest amounts of seafood, the Mediterranean diet provides abundant polyphenols, mono and polyunsaturated fats, and fiber. These food components may support mechanisms for weight loss, including stimulating thermogenesis, reducing inflammatory signaling, normalizing adipose tissue metabolism, triggering satiety signaling, and improving the health of the gut microbiome. Plant-based diets are associated with a lower risk of metabolic disorders, including obesity, type 2 diabetes, and cardiovascular disease, whereas high meat intake is associated with weight gain, higher BMI, and poorer metabolic parameters. Observational research indicates BMI increases as the amount of animal food in the diet increases, such that the BMI is lowest in vegans, those who avoid all animal foods, higher in vegetarians, who include dairy, eggs, and/or fish, and highest in non-vegetarians. A meta-analysis that included 12 studies with 1,151 overweight and obese participants found vegetarian diets, and especially vegan diets, were associated with greater weight loss than calorie-matched non-vegetarian diets. The positive health effects of plant-based diets might be due to the inherently high nutrition quality of most plant-based diets, which typically includes more fruit and vegetables and fiber than omnivore diets. Strict vegetarians should consider supplementing with vitamin B12 and possibly calcium. In a 16-week clinical trial, 75 participants with a BMI between 28 and 40 kg per meter squared were randomized to follow a low-fat vegan diet or to maintain their current diet. In the intervention group, insulin resistance decreased significantly. Fat mass decreased an average of 9.5 pounds, and total weight decreased by 14.3 pounds, versus no significant changes in the control group. In a second 16-week clinical trial, carried out by the same principal investigator, 244 participants with a BMI between 28 and 40 were randomized to follow a low-fat vegan diet or continue their normal diet. The study assessed more variables than the first. In the intervention group, there was a significant decrease in insulin resistance, fat mass and visceral fat, and total average weight loss of 13 pounds. Additionally, after-meal energy expenditure increased 18% in the intervention group, indicating increased after-meal metabolism. Differences in intramyocellular lipids, or fat stored in the muscle cells, and hepatocellular lipids, fats stored in the liver cells, both biomarkers associated with type 2 diabetes, were also measured. The results showed a mean difference of 10% in the intramyocellular cells and 34% in the hepatocellular lipids in the intervention group. There was no significant changes in the control group for either of these outcomes. Intermittent fasting has recently gained attention as a new strategy for re-establishing healthy metabolic function and losing weight. In addition to reducing total calorie intake, fasting for periods of 12 to 36 hours activates metabolic pathways that promote fat burning and may trigger weight loss without loss of muscle. Most intermittent fasting diet plans dictate either time-restricted eating or periodic fasting lasting up to 24 hours. One common example of time-restricted eating is fasting for 16 hours each day and eating according to the appetite for the other 8 hours. Prolonged overnight fasting not only reduces the total calorie intake, but it also takes advantage of the body's circadian rhythms in ways that may further support a healthy metabolism. Full day fasts may be practiced on alternative days or 1 or 2 days per week, with very few, such as 25% as usual, or no calories taken on the fasting days. Despite the theoretical advantages of intermittent fasting, more research comparing it to general calorie restriction have found no difference in weight or body fat reduction. Nonetheless, it's noteworthy that some studies have shown time-restricted eating with prolonged overnight fasting naturally resulted in reduced nighttime hunger, lower overall calorie intake, and weight loss that may be easier to sustain over time. In addition, some evidence suggests intermittent fasting may induce less adaptive decline in energy expenditure, possibly leading to better long-term weight management. For more information, continue on the weight management series, and for information about herbs, supplements, and natural treatment plans, check out my website.